Today, we're diving into a drug that's basically a peacemaker in a war that's being fought inside the human body. It's called Adalimumab, and while it's been a game changer for millions, it comes with a really serious trade off. Let's get into how it all works. So, right at the center of all this is a really tough question. What do you do when the very system that's supposed to protect you, your immune system, gets its wires crossed and just launches an all out assault on your own healthy cells? It's a massive, devastating problem. And this kind of internal conflict, well, that's the day-to-day reality of autoimmune disease. Instead of just fighting off germs, the body's own defense system turns on itself. It causes this constant inflammation and damage to everything from joints to skin to organs. So to find a solution, first you have to identify the enemy's chief signal caller. And that signal caller is a protein called tumor necrosis factor alpha, or TNF-alpha for short. Now, in a healthy body, TNF-alpha is a good thing. It helps create inflammation when you need it, to fight an infection or heal a cut. But with autoimmune diseases, the body just goes into overdrive and makes way too much of it. It's basically like a fire alarm that's broken and stuck in the on position, just blaring constantly, causing total chaos and damage everywhere. So if the problem is a faulty signal, right, the solution has to be a way to shut that signal down, right at the source. And this is exactly where Adalimumab comes into the picture. It's not some general painkiller. It's a super specific intervention designed to find and silence that one rogue signal. So what is this stuff really? Adalimumab isn't a simple chemical pill. It's what we call a biologic, which is a complex molecule made using living cells. To get even more specific, it's a monoclonal antibody. Think of it like a lab-engineered homing missile that mimics our own antibodies but is programmed with one and only one mission: to find and take out TNF-alpha. So how does it actually pull off this mission? Okay, so the body is just flooded with all this extra TNF-alpha, causing inflammation. Then adalimumab is injected. Its specialized antibody molecules start hunting. They literally seek out the TNF-alpha proteins and bind right onto them. This effectively takes them out of the game before they can cause any more inflammation. So they don't just muffle the fire alarm, they find the right wire and cut it. And because it targets such a basic, fundamental cause of inflammation, adalimumab becomes this incredibly versatile weapon. It's not just for one specific problem. It can be used on a whole bunch of different fronts in this internal war. 9. That's the number. 9 different autoimmune conditions are on its official list of FDA approvals. And that number alone just shows you how central that single rogue TNF-alpha signal is to a whole range of diseases that, on the surface, might seem totally unrelated. And look at this list. We're talking about conditions that affect the joints, like rheumatoid arthritis, the skin, like plaque psoriasis, and even the digestive tract, like Crohn's disease. They all show up in different parts of the body, but they're all being fueled by that same inflammatory fire. That's why one key can open so many different doors. But, and this is a really big but, this is where our story takes a very serious turn. Because achieving this kind of internal peace, it comes at a price. The very thing that makes adalimumab so effective, turning down a key part of the immune system, also creates its biggest risks. And here's the fundamental dilemma. You have to remember, TNF-alpha isn't always the bad guy. It's actually a vital part of your body's security system. So to stop it from overreacting, adalimumab has to dial down that entire security operation. And, well, when you intentionally weaken the guards, the whole fortress becomes a lot more vulnerable to outside attacks. And that trade-off is pretty stark when you look at it. On one hand, you have the common side effects, things like redness where you get the shot or headaches, annoying but often manageable. But then, on the other hand, you have the black box warnings. These are the most serious alerts the FDA can issue, and they cover risks that are severe and can even be life-threatening. Yeah, that quote is pretty chilling. Because the immune system is turned down, patients are much more vulnerable to all sorts of infections. We're talking serious ones like tuberculosis or invasive fungal infections. The sources also point to a higher risk for certain cancers, like lymphoma, and even the possibility of waking up dormant viruses like hepatitis B that were already in the body. So this makes it crystal clear. Using adalimumab is never a casual choice. It is always a calculated risk. It's an incredibly powerful tool that requires constant watchfulness to make sure that the benefits continue to outweigh those very, very real dangers. So how is that risk managed? Well, there's a strict set of safeguards.
Before a patient even starts, they're screened for hidden infections like TB. During the treatment, they absolutely cannot get any live vaccines because their immune system just can't handle them safely. And all the while, there's ongoing monitoring with doctors and regular blood tests to keep an eye out for any sign of trouble.
And all of this brings us to the ultimate point. For millions of people who are trapped in this daily battle with their own bodies, adalimumab has been nothing short of a miracle. It offers a sense of peace and normalcy they thought they might never have again. But it's a peace that always comes with that constant, critical question for every single patient and every doctor. Is the life-changing benefit worth the profound risk of lowering the body's own defenses?